Thank you so much for joining us today on the Abundant Life today. I am very excited because I have a special guest who is no longer a guest to the Abundant Life family. It is Dr. Roshana in the house. The last time she was with us, we talked about depression and it was just excellent. We learned so much and I had to have her back to deal with the topic of anxiety. So for those who do not know, Dr. Roshana is a double boarded certified psychiatrist. She works with adults and children and adolescents, and she's the author of the book Prehab Before Postpartum. There it is on your screen. This is a must have because there's so many women who go through postpartum and have no idea what's happening. So education is the key, and the coolest part of it is that she also shares her own personal journey, which is it's so profound because she herself went through that challenge as a person who is trained, and so it comes out from a personal place, which is a wonderful story and journey. So today we will be talking about anxiety. And if you've been following the series, I hope you've been watching the videos and trying to educate yourself about what it is, how it affects you, how to relax, how to control the mind, self-talk, all those good stuff. On that note, we can start talking about, how is this treated, right? Like, what is the approach that, for me as a therapist, I go into, okay, let's look at the coping skill, let's understand what's happening, and let's create a plan. And it takes different forms, whether we do exposure therapy or we have a list of things we want to do, like relaxation, the thoughts, all that good stuff. But there, at some point that don't work.
Right,
It
right,
just doesn't, or it works in combination as you were saying. So what does the treatment look like with all these different
right.
challenges?
So I'm a big proponent of supportive therapy. I think that, you know, we're not born knowing how to cope. We do things off of instinct and what we
Exactly.
observe and learn, you know what I
Mhm.
mean? And
Yeah.
so same thing with parenting, so
Yeah.
it's so essentially ideally medication and therapy if it's moderate to severe, right? And especially if you've given therapy a really good try and it's like, I'm still not really progressing. And
Hmm.
that says we need a little more support for right now. And
Yeah.
that may be medication. There's different types of medication. Some
Okay.
medications we may use for acute anxiety. So during those panic attacks, maybe. But and then those are medications you may have heard in the benzodiazepine family. There's some other medicines we might use for acute anxiety that are not in that family,
Hmm.
but that's typically considered a temporary treatment because the goal is to bring down that anxiety to manageable levels and for
Hmm.
you to then utilize the coping strategies and skills that you've learned in therapy. Okay.
So
So
for
then,
chronic cases, I don't mean to cut you off. Because you said a whole lot there. I want to make sure people get what you're saying. So for cases that are severe, you probably would consider using benzoids, right?
or a
Um,
non-benzo that can help with the that acute anxiety, like maybe,
Cute. Okay.
yeah, the acute. So acute basically meaning like maybe the person is having anxiety attacks every single day. We need to kind of slow that down,
Okay.
so that might be acute. Or maybe the person's anxiety is very severe. They're not having anxiety attacks, but their level of functioning is just really low compared to where they once were. And so sometimes we might use medications acutely while starting another medicine that is supposed to help with it more long term.
Okay. Okay.
Because sometimes those medicines may take a couple of weeks to kick in. So what do we do between now and when the medicine kicks in and your anxiety is like through the roof?
Okay, so there seems to be more fast acting then. So you might want to act right away and then go into something more sustainable.
Correct.
Okay.
Yeah. And those medications typically considered for the more sustainable period of time are the main category is selective serotonin reuptake inhibitors, SSRIs.
Okay.
So those are medications like Zoloft or Lexapro or Celexa or Paxil, for instance. They're not identical. They're similar, and some may work better in one person versus the other. But typically speaking, those can take anywhere from maybe 4 to 6 weeks for you to really fully benefit from it.
6 weeks. Okay.
And so hence what we mentioned earlier, that acute period, what do we do? And those don't have an addictive potential or anything like that. So you take it and mean that you become dependent on it. That's not how we define dependence, in the mental health world. So it's not like, oh, I got to, I take this SSRI for my anxiety or my depression. That means I'm addicted to it. No, I'm dependent on it. No, that's different from like illicit drugs like marijuana or cocaine, that type of thing.
So it's not dependency.
No.
I think that is a major trigger for people, especially for persons who grew up in environments where their families abuse drugs. People have a hard time with going on medication for anxiety consistently because they believe that they're becoming dependent.
Right.
So you're saying it's not a dependence, it is a need for functioning.
Okay. Exactly.
Yeah.
Absolutely. Because those who are dependent, if you think about it, like those who are dependent on those illicit drugs, how was their behavior like when they're using that drug?
Good point there.
Right? Versus a person that's being prescribed a medication that does not have a risk of dependency, such as a SSRI. The behavior is different. It's not the same.
So your behavior, so I just had a little epiphany there. So your behavior is not declining.
Correct.
It is whatever you're doing should be improving your functioning, improving your relationships, improving your clarity, an ability to do the things you want to do.
Absolutely.
That's aiding,
Absolutely.
functioning. While if you're depending on drugs and you're addicted to drugs, it's obvious, as you said.
Right.
There's a decline in your thinking, behaviors, and how you interact with people around you.
Absolutely.
That's just thank you for that, because I think that's very helpful for a lot of people who struggle in this area.
Yes.
That's super helpful.
Good. Helpful. And it's not even those illicit drugs are primarily not even it's primarily dopamine. It's dopamine versus with the anxiety and depressions. A lot of it deals with serotonin, a few others, but primarily serotonin. So they're two different chemicals as well that they're impacting.
So because I like to be real in our conversations. So I want people to know what they're doing and the impact it can have. So within the medication family for anxiety, as you mentioned earlier, there are some anxiety medication that you use when it's chronic and you want to get results quicker. The question is, can those become addictive? And what is the risk of people continuing to take them beyond that period?
There are some medicines, again, that are used for acute purposes.
Okay.
Generally speaking, the most commonly used ones are the benzodiazepines. Those are Ativan, Xanax, Klonopin, Valiums, for instance. There are some medicines that are the non-benzos that we have used to help with acute anxiety as well. And those typically are not dependent. They don't have a dependency risk.
Okay.
The benzos can provide, they have a purpose, but generally speaking, it's not for long-term use.
Okay.
It's to try to get a person through these rough patches, right? And ultimately, the goal is, again, to get that anxiety down to a manageable level, and where the person can utilize the coping strategies and skills. Okay. So if it's used beyond, like, so for instance, there are some people who may, like, if it's being used every day for extended period of time, then that tells me that you need something that's going to help you a little bit, sustain you.
Right.
That is the acute piece, that you're using it to help sustain you, and that can put you at risk. So if you're needing it that frequently, me as a psychiatrist, that tells me that we need to find something different.
Right.
Because sometimes people will take it and take it and take it, and then they find themselves needing more and more of the higher doses of the same one to get the same desired effect.
Okay.
So taking it, I do have some people who might take it, like they may have 30 pills for a year.
Yes.
So that's like a month,
Right.
and so they have that just in case. They may have an anxiety attack maybe once every 3 months or something like that. They may take it like that. But if it's like a everyday type of thing, and you're doing it every day for several months in a row, then that's you need something different.
That's something different. Okay.
But if you're taking it maybe once a month, that's reasonable. That's not going to cause, dependency or anything like that. But if you're taking it like every day for several months in a row, that is, you're putting yourself at risk. On top of that, that tells us we need a different type of treatment, because that's not the purpose of those type of medications.
What about persons who have particular phobias, but they don't necessarily encounter those phobias on a regular basis? Would that be a fit for those people who,
It depends. It depends. Sometimes for some people, yes. But again, one of the goals is we want the person to learn, to try to figure out we want to get to the nitty gritty of it. We want to get to the core issues, right? And we want to teach you some coping strategies. So ideally, as you're working and learning the skills, sometimes we might give it to the person, especially if it's doing some exposure therapy that type of thing, to help them as they're going through the therapeutic treatment, so that hopefully they can then utilize those strategies and skills
and combination
to manage the anxiety without the aid of medication if possible. Yeah. Because like, especially if, it depends. Like if it's a phobia, like come across, I don't know, spiders, you may not come across spiders like that. You know what I mean? But then maybe another type of phobia, maybe heights, and, maybe they work in a tall building or something like that. So it really, it depends, right, on the individual. So we do try to do it case by case. We try to look at your unique circumstance and try to come up with a personalized treatment plan that will work for you.
Okay. And that makes sense. And that is why it's important to talk to someone. I keep repeating this intermittently, because the main point of this conversation is to help all of us to understand and know, like, when is it the right time to seek support, and not just any support, but people who are specialized in the area to give you good support. I did mention in one of my videos that, there are other medical issues that can present as anxiety, but it's not. Can you talk a little bit about that?
Yeah, so sometimes, chronic medical issues can be a trigger, or can exacerbate or can mimic. One of the
Okay.
common one that can mimic anxiety is issues with your thyroid.
Mm-hmm.
Thyroid disease can cause heart palpitations, sweating, hot flashes, all those type of things. And so sometimes people may, all of a sudden this is happening. They're like, and they're not menopausal age or anything. So they're like, what's going on? So it could be mistaken as anxiety, if not worked up. So if you're having symptoms of anxiety or any of those symptoms that we mentioned before, it's good to, if you don't have access to a psychiatrist initially, it's good to start with your primary care doctor who can then rule out medical things. That's one of the things that we as psychiatrists want to do. We want to rule out any general medical things
Right.
that could be causing causing these symptoms before we settle on this maybe mental health, because it could be a thyroid issue. It could be a heart issue, maybe you have some things going on with your lungs, or maybe it's cancer. So we have to rule out those general medical things first, and then once they're ruled out, then we look, okay, then we've ruled that out. This may be more mental health related. Some is some regarding anxiety specifically.
Right. Right.
Yeah.
Okay. So the ruling out is critical of general medical issues.
And sometimes
Okay.
when you're on, say you have a chronic medical issue, you're on medication for it. Sometimes medications can mimic it too. So that's why it's important to follow up, be consistent in following up with your healthcare providers, so that you have eyes on you, and those things can be ruled out, ruled in, or whatnot.
Thank you for that. Okay. So children, let's talk about children.
Okay.
Does anxiety challenges or disorders present the same in children? Is there any differentiation or differences with
So children can have pretty much all of the same um,
okay.
disorders. They may present differently, um, especially given their age, um, where they are developmentally.
Right?
Typically, the brain doesn't fully mature until like early 20s, mid 20s. So the brain is evolving, it's growing, it's changing. And so is their mental capacity. So, for instance, younger children may have more nightmares. Maybe they were potty trained and now they're no longer. They're having bed, enuresis or wet in the bed. Maybe they're having tantrums that are not typically seen for that age.
Mm-hmm.
Um, Maybe they are more irritable or having concentration issues. Um, Having a hard time falling asleep, or maybe they're sleeping in school. So these can be signs of anxiety, but we can't just go off of that. We have to get the whole picture. We have to get it in context, right? Because, for instance, I said difficulty concentrating. That's generic, right?
Yes.
You might say, oh, my child has difficulty concentrating. Maybe they have ADHD. Not necessarily, right? So you have to get I liken ourselves to investigators. We have to get the whole picture, get all the details, so we can put the pieces together, so that we can find out what's actually going on with the child, and so they can get the proper treatment.
Thank you. That's helpful. So there are developmental differences in how the presentation looks, and it can also mimic other types of child in terms of having similar symptoms. So it's important, parents, it's important to talk to someone who's professional. If as parents, we kind of see when our children are kind of not, behaving in the way that they used to or should, to have a little hunch that something is wrong, but we just don't know, right? And even teachers might notice and be talking back, to you as parents. So please try to talk to someone who is able to offer a proper assessment and the right context. So it's a context sort of assessment to say, okay, what's really happening, so it can be targeted properly.
Absolutely. And then the
That
treatment
makes
may
sense,
vary. The treatment might be different too. Sometimes
right?
depending on how severe the symptoms are with the child, whatever type of anxiety, medication may be part of it, or play therapy. And the way I try to tell parents is, again, the brain is still changing, evolving, and so forth. A 3-year-old may not have the ability to say, well, my depression or my anxiety started when such and such and such. They don't
Right.
do that. So we have
Yeah.
to figure out other ways. What is their mode of communication? And so
Mhm.
one of the main modes of communication with children is through play.
Yeah.
So when children engage in play therapy, some parents are like, they just play. But there's a method to the strategy. There
Definitely.
really is. And
Definitely.
so there are things that you can discover and play and drawing, things like that, because they don't have the ability yet to be able to express
Mhm.
what's going on with them. They don't have that capacity yet, depending on how old they are, right? So the treatment may vary, of course, based off of their age and their presentation.
Okay. Okay. Thank you for explaining that. So families who, need to be more aware.
Mhm.
Yeah, that it might look different. Um, I don't know. I think we have covered a lot in terms of treatment, types of disorders, children, medication. So for the medication for children, are there any differences in what they're given, or you said it's basically the same, or
It can be. It really depends on how severe. So generally speaking, if the anxiety, and goes for adults or children, if the anxiety is considered mild, we're going to be like, okay, let's do the therapy,
okay,
or self-talk, things like that. If it once it gets into the moderate to severe, then we're like, okay, therapy, yes, still. But
mm-hmm.
then we're looking at, oh, maybe medication. Now, the medication regarding children, depending on their age, some medications uh, are not advised to use in children, younger
Okay.
ages,
Mm-hmm.
whereas some are you're able to. Now, usually with children, because their brain is rapidly changing this, and so
Right.
when we
Right.
start medications, if we start medication, we're going to follow them very closely. Um, we may follow them once a week or maybe every 2 weeks to begin with, just to check in, make sure that they're tolerating it okay, make sure they're doing okay.
Mhm.
Um, because we want them to have um, a safe and good experience. Because sometimes if we don't follow people closely, whether it's children or adolescents or adults, they have a side effect that just ruins. It can potentially ruin the future of them trying other things. So,
Right.
as talking to other healthcare providers, if we can answer as many questions as possible, take the time to make sure they're doing okay, checking up on them, that will be awesome. Because they're
Mhm.
already nervous about, even
Exactly.
consideration
Exactly.
of medication. So I
Mhm.
think that's, we have to be mindful of that as healthcare providers, of where people are, you know. But yeah, depending on the age, some medicines we don't use, and some medicines we will
You
use
do.
depending on the
Okay.
age.
Okay. And I know that's, done. Medication is usually offered when it's really severe and when all other things have been tried. And
Mhm.
that's the best way. Because I find that working with children, they are so resilient, and they will try stuff so readily and get excited about the difference they're seeing, once
Mhm.
they get the hang of it,
Mhm.
you see the difference. So it's really, medication comes into play, well, should come into play
Mhm.
when all other options have been
Yeah. Yeah.
exhausted.
Yeah.
Yeah.
And that's typically, and by the oftentimes that's when I've seen people, that's usually where they are. They've tried other things,
Mm-hmm.
and
Mm-hmm.
those things have not really been successful. Another thing I think is important with treatment is, what I've noticed is, children, of course, we know children, they look at us as parents, they model us, they study us. And so sometimes our beliefs about medication and treatment the
Yes.
children can take that on as well. And so if you're kind of in limbo about how you're feeling, I would tell parents to try their best to keep it, process it, but try not to,
Don't transfer it.
yeah, transfer it. Right, exactly. Because, it could,
Yes.
one of the things you can see with anxiety and depression, you can see it generationally, right? You parents, you can probably think back and maybe it was a relative that wasn't officially diagnosed, but as you've been listening to the Abundant Life series, you're like,
Yes.
oh,
Yes.
so and so probably was dealing with this, or I was dealing with this, and
Mhm.
so it can have generational transference. And so we really are trying to, with it can start with you, stopping that generational transference of the anxiety or depression and things like that. It can start with you so that your current generation and or your future generation won't have to go through the same things.
Mhm. Breaking cycles, right? By being
Absolutely.
open to educating ourselves and learning more about our bodies and going to the right people and getting the
Absolutely.
right support. That is powerful. And that's why I love you, Dr. Ashana, because you are such a thorough doctor, right? And I send everybody to you. I'm like, no, you must see Dr. Rashana. She's like, no, listen, whatever you're dealing with, you have to go to doctor. Because it's true though, because you take the time to actually talk to people and find out what's really happening because you really want to be sure, and to give the best support. And that is priceless.
Absolutely.
And
Thank you.
especially in our community, that is priceless, right?
Mhm.
For us as a people, who have been through so much and we are trying to, put the pieces back together. We really need people who are patient and who are culturally competent and knowledgeable, right? But in general, for any background, whichever background you're from, it's very important to have someone who is thorough and who can do a proper assessment, and that will give you a more effective treatment plan. So,
Absolutely. Because things can mimic, you have a lot of
yeah.
things that can mimic and look like other things. So it's very important to try to get as much detail as possible because some
Mhm.
treatment can be helpful, but if you give the wrong treatment to the wrong thing, we don't want that either. So it's very important. So it's like with any relationship, if you have a doctor or a therapist right now you're not connecting with, express that to them.
Yes.
See if you all can work through it. But if not, don't stop. Find your right match.
Find your right match. I'm going to type it down there. I'm going to type it. You see the words? Find your right match. Because it's a relationship. It's a
It is.
relationship. And it's a sometimes long-term relationship. You might have meetings more regularly initially, and it might go to 3 to 4 times a year after. But so for some people, it's a long-term relationship. And when you cannot be open if you don't trust the process, right?
Exactly.
So if you're not comfortable, find the right match. We should do a t-shirt for that. Find the right match. It's out there, right? Your right match is out
Absolutely.
there.
Mhm.
It is always so nice chatting with you, Dr. Rashana.
Same here. I always
um,
enjoy myself.
Thank you for always coming by and just being so open to share your knowledge. And as I always ask you, please tell the people how to find you, where to find you.
Yes. So you can go to my website, which is drrashana.com. That's drraushana.com. Or you can go to LinkedIn, Facebook, Instagram, and go to at Dr. Rashana. Again, drraushana on all those social media platforms.
Perfect. Perfect. So write it down, people. It's right there. You're looking at it right now. You have to write it down. Share it with your friends, share it with your family. As we said at the beginning, if you have been utilizing all your efforts and you realize that it is still a challenge, talk to somebody who specialized in the area. And I just presented a person to you. I don't know where you're watching this from, but I wanted to say and put it out there because the persons have contacted me about seeing you, but you can't see them because you're not licensed. You're not licensed outside of Georgia. Is that correct? So you
That is
are licensed
correct.
in Georgia.
Yeah, only for Georgia as of right now.
So she is licensed in Georgia. So if you're in the area of Georgia, you live in Georgia and you want to reach out, please do. And let her help change your life, right? As she has done for many other people. Thank you so much for watching The Abundant Life today. Again, please watch, take what you receive, and go out and live your best life and be in control of your life. And as I always say, see you soon, and I hope this was helpful. Bye.